Hi, I'm Sharina Jane Dulay and I'm going to tackle about the range of motion. Exercises that are performed by a patient himself or by a nurse in case of helpless patients. It is to mobilize all joints through their full range. RO, ROM exercises or the range motion exercises are those in which a joint is moved through its full range of motion according to its capacity. Range of motion exercises are designed to move the joint and soft tissues through the available physiologic ranges of motion. So the purpose of this ROM exercises is to prevent the development of adaptive muscle shortening, contractures, and shortening of the capsules, ligaments, and the tendons of the patient. So there are two types of ROM or the range of motion. These are the active and the passive motion. So the active range of motion is done by the patient himself, while the passive range of motion is done with help of assistance from another person. So, active range of motion exercises helps improve joint function, and range of motion is how far you can move your joints in different directions. So later, we're going to do some examples. These exercises help you move each joint through its full range of motion. Movement can help your joints flexible, reduce pain, and improve balance and strength. So for our example, we're gonna do a shoulder joint range of motion. So a shoulder range motion, let's see if I will be as a patient. So I'm gonna do the active range of motion exercise using my shoulder. So now, okay, my full capacity is okay. As I said a while ago, the purpose of the range of motion is to increase muscle strength and endurance of the patient, to maintain the normal physiological function, to prevent complication caused by immobility like contractures, to improve patient participation in activities of daily living or the ADLs. So, it also to improve physical activity so the patient can do what he like or he does during his younger years, not the younger years, but the things that he wants to do in such a way he can do it by himself. So it also to increase joint flexibility so that when he move his body or her body, he will not get hurt because the joints of her body is flexible. So now we're going to terminologies. So first is abduction. It is the movement in the coronal plane that moves a limb laterally away from the body. For example, my hand. I'm going to spread, the example is I'm going to spread my fingers away from each other like this. This is what we call abduction. So, the other one is adduction. It is a movement in the coronal plane that moves a limb medially toward each or across the midline of the body. So, I'm going to do an example with my fingers again. So, a while ago, abduction is moving away the fingers from each other. Now is adduction. It is bringing my fingers together. Now, and the next one is the circumduction. It is a circular motion of the arm, thigh, hand, thumb, and fingers that is produced by a sequential combination of flexion, adduction, and extension and adduction. Example, circumduction is through like this. I'm going to do a circular motion of my arm and fingers like this. It is a circular motion. Next is the opposition. Opposition is the thumb movement. So, thumb movement that brings the tip of the thumb in contact with the tip of the finger. So, from tip of the thumb to tip of the finger. We're going to bring this together. So, from thumb to tip, they must have contact. Like this, contact. Actually, may injured yung right hand ka. So, from thumb to tip of the finger. So, this. From thumb to tip of the finger. So, the other one is the reposition. It is the movement of the thumb from opposition back to the anatomical position. It is the next to next to the index finger. So, like this. Reposition. Yan siya. Right, so this one. Reposition. It is the movement of the thumb from opposition, this opposition, back to the anatomical position. So, from opposition to anatomical position, which is the reposition. Okay? Opposition. Ito, baka hindi nakikita. From opposition to the reposition. From the going back to the anatomical position. We're going to differentiate depression from elevation. Depression, it is a downward inferior motion of the scapula or mandible. It is like my shoulder. It is depression. It is downward motion. So, while the elevation is the upward or the superior motion of the scapula or mandible. So, we're going also to tackle about the dorsiflexion. It is the movement at the ankle that brings the top of the foot towards the anterior leg. Another example of depression and elevation is through my jaw. The depression is like this, and elevation is when you put your jaw together. Depression, elevation. So, the jaw is downward, it's inferior, is the depression. And the elevation is the superior, which is the upward. Eversion is a foot movement involving the intertarsal joint of the foot, in which the bottom of the foot is turned laterally away from the middle. While the inversion, it is a foot movement involving the intertarsal joint of the foot. So, the example is dorsiflexion. When I move the movement at the ankle that brings the top of the foot towards the anterior leg. So, like that. In neutral position, so we're gonna do an eversion, which is laterally turned away from the midline. So, away from the midline. The one that is called the intertarsal joints are this one. Are this. So, I already put it away from the midline. So, I'm gonna do the inversion. So, inversion, let's put it in neutral position first, and then we're gonna do the inversion. It is turned toward the midline. So, it's up actually. You may not see it, but it's like I move it toward the midline. It is the inversion. Okay? This is the neutral position. So, eversion, then inversion. Now, let's do an example of a plantar flexion. Since it is the foot movement at the ankle, which my heel is lifted off the ground. This is the ground. This is my heel. So, I now do the plantar flexion. I lift my heel off the ground. So, plantar flexion. Okay, plantar flexion. Plantar flexion. So, a while ago, we discussed about the dorsiflexion. It is the movement at the ankle that brings the top of the foot towards the anterior leg. So, dorsiflexion normal position, then we do the plantar flexion. Plantar flexion, dorsiflexion, and plantar flexion, dorsiflexion, plantar flexion, dorsiflexion. Next is the extension. Extension is the movement in the sagittal plane that increases the angle of a joint. It straightens the joint. Motion involving posterior bending of the vertebral column or returning to the upright position from a flexed position. While the flexion is a movement in the sagittal plane that decreases the angle of a joint. It's going to bend the joint. Motion involving the anterior bending of the vertebral column. Now is the extension. It is the movement in the sagittal plane that increases the angle of the joint. It straightens the joint. Motion involving the posterior bending of the vertebral column or the returning to the upright position from a flexed position. From flexed position to extension. So, while the flexion is the movement in sagittal plane that decreases the angle of a joint, it bends the joint. It is a motion involving the anterior bending of the vertebral column. So, it is a flexion, extension. Let's put it straight one. Okay, again, flexion, extension, flexion, and extension. Next is the hyperextension. It is an excessive extension of joint beyond the normal range of movement. And while the hyperflexion, it is an excessive flexion of joint beyond the normal range of movement. So, for example, in my head, the normal extension is just like this. So, I'm gonna do a hyperextension. It is beyond the normal range of motion. So, the flexion in a normal range of motion is like this. But when we do the hyperflexion, is like this. It is beyond the normal range of motion as well. So, inferior rotation is a movement of scapula during upper limb adduction in which the glenoid cavity of the scapula moves in a downward direction as the medial end of the scapular spine moves in an upward direction. Now is the lateral excursion. It is a side-to-side movement of the mandible away from the midline towards either the left or the right. So, for example, this is the mandible, right? So, towards the left or the right, let's do it. It's the largest one in the skull. It is actually, I think it's the jaw. Lateral excursion. So now it is the lateral flexion. It is bending of the neck or body towards the right or left side. So bending of the neck towards the left or the right, bending of the neck from right to left, left to right. It also said it's body, right? So, for example, it is bending of the body towards the right and the left, or actually, right, left, or left, right. Next is the lateral or the external rotation. So, lateral rotation is the movement of the arm, shoulder joint, or the thigh at the hip joint that moves the anterior surface of the limb away from the midline of the body. For example, first one ay shoulder joints. So, let's use the head, neck, and the shoulder. So, lateral or external rotation, it is from the limb away from the midline of the body. So, like this, rotation away from the midline of the body. Parang ngayon lang ako na exercise. it's, since it's a rotation, it's left and right. So, let's do on the thigh at the hip, that moves anterior surface of the limb away from the midline of the body. So, yes. So, from the limb, it is the limb away from the midline of the body. So, this thigh, away from the midline of the body. Okay. Next is the medial or the internal rotation. It is the movement of the arm at the shoulder joint, at the thigh, at the hip joint that brings the anterior surface of the limb toward the midline of the body. Next is at the thigh. So we're gonna do this an example as well. So lateral or the external rotation of the thigh at the hip joint that moves, it is limb away from the midline of the body. So, away from the midline of the body. Rotation away from the midline of the body is the lateral rotation. So, next is the medial rotation. It is the movement of the arm at the shoulder joint or the thigh at the hips joint that brings the anterior surface of the limb toward the midline of the body. So, for example, the medial rotation from our shoulder, we do this in lateral or external rotation. A while ago, it's from this. Now, we're going to put it in a medial rotation, going to the midline of the body, towards the midline of the body, from lateral rotation to the medial rotation, lateral to medial rotation, lateral to medial rotation. So, in the thigh, lateral rotation to midline, which is medial rotation, lateral rotation to medial rotation, lateral rotation to medial rotation, lateral rotation to midline rotation. Now is the pronated position. It is the forearm position in which the palm faces backward. So backward, that way. Pronated position. So supinated position is the forearm position in which the palm faces anteriorly, anatomical position. So the pronated position, supinated position, when we do this is what we call pronation. It is a forearm motion that moves the palm of the hand from forward to the palm to the backward position. So, supinated position and then pronated position. Supinated position, pronated position. When we do this, it is called the pronation. Okay, the protraction, it is the anterior motion of the scapula or mandible, and while the retraction, it is the posterior motion of the scapula or mandible. So, let's do an example. In my jaw, the mandible part, the protraction to retraction, protraction to retraction, protraction to retraction, so sideways. So that protraction, retraction, protraction, retraction, protraction, retraction. Another example using our shoulder for the retraction. The retraction a while ago is a posterior motion of the scapula or the mandible, right? So, protraction, retraction, protraction, retraction, protraction, retraction. Rotation is a movement of bone around the central axis or the atlantoaxial joint or around its long axis, which is the proximal radioulnar joint or the shoulder or hip joint. It is the twisting of the vertebral column resulting from a summation of small motions between adjacent vertebrae. So we do the medial rotation, medial. So now, we do an example. We do a medial rotation, lateral rotation, medial rotation, lateral rotation, medial rotation, lateral rotation. So medial rotation, lateral rotation, medial rotation, lateral rotation. Medial rotation, lateral rotation. Next is the superior rotation. It is the movement of the scapula during upper limb abduction, in which the glenoid cavity of the scapula moves in an upward direction as the medial end and the scapular spine moves in a downward direction. Example, the downward rotation and then upward rotation. This is what we call superior rotation. So alternate, 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 alternate. This is what we call superior rotation. Clockwise. Superior rotation. Yeah. Downward rotation and upward rotation. So there are points for us to remember as caregivers or the person who will going to assist the patient. So passive range of motion exercise should be done only on patient who are unable to do it on their own. Because there, as what we said a while ago, there are two types of range of motion. The active range of motion and the passive range of motion. If it is an active range of motion, they can do it by themselves. So, as we're going to do a passive range of motion, we're going to assist them. So, the passive range of motion exercise should be done to point of slight resistance. Never do range of motion exercises beyond capacity of individual. That is the point of discomfort. So, never, 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 never do a range of motion exercise beyond the capacity of individual for us to not give them the feeling of the discomfort and for refraining from hurting them in some other way. So, next point to remember is we should move the body parts smoothly, slowly, and rhythmically. It's with the rhythm. So, again, it must be smoothly, slowly, and with rhythm. So, we must not pressure them to do it faster and to put them in a way that they will be discomforted. So, another one to remember is expect the heart rate, respiratory rate to increase during the exercise, which return to resting level within 3 minutes. If not, exercises are strenuous for patient. So, let's always check the heart rate and the respiratory rate. And we must also be concerned for the discomfortness. So, if the patient feels discomfort, so we should not, it's not that we end the range of motion, but let's put it in a smoothly way and slowly and with rhythm so that they will be comfortable with the range of motion exercise. And for them to like to do it again and again, they must feel that they are comfortable and they do want to do it. So, another point to remember is if the muscle spasticity occur during the movement, stop movement temporarily, but continue to apply slow, gentle pressure on part until the muscle relaxes, then proceed with the range of motion exercise. So, let's not do it fast. Just slow, smooth, and with rhythm. So, they will feel love, I think, and for them to be comfortable. And once, and maybe in some other time, they're going to ask you to help them. So, doing a range of motion has a pre-procedural steps. One is to remove the tight clothes and provide hospital gown or loose clothes. It is for them to provide, to have, or to be comfortable for the clothes that they're going to wear. So, I am the only one here, and I'm going to portray as a patient. So, I'm already using a scrub suit which is loose and comfortable. If you have loose clothes, hospital gown, scrub suit, or whatever it is, you may ask or let the patient choose whatever they want to do, what they want to use, because what we want them to have is to be comfortable. Next, for a pre-procedural steps is to cover the patient with sheet and assist in assuming a supine position. So, supine position is a supine position. So, now there are intra-procedural steps in doing the range of motion exercises. So, first start with providing the range of motion from head to downward. So, let's start from the neck. So, we're going to move the head through the flexion, extension, lateral flexion, rotation, and then hyperextension. Then, movement of the head is contraindicated in a supine surgery, spine trauma, and patient having central vein line. So, let's do an example while we are in a supine position. So, now, assuming I am the patient, so I already assist the patient into a supine position and cover the patient with sheet to provide privacy during the range of motion exercise. And also, I already washed my hand. And now we're going to do the range of motion exercise. But when we do the range of motion exercise, we're going to expose the part that will do the exercise. So it is the neck. The neck. So we're just going to expose the neck. So let's cover above this chest. Then okay, we're going to do the range of motion. First is the flexion. So flexion. Next is the extension. Next is the lateral flexion. And then the rotation and the hyperextension. So, is it clear? This one. Ulit. Again. So, flexion, extension, lateral flexion, rotation, hyperextension. So, flexion, extension, lateral flexion, rotation, and then hyperextension. So, in a range of motion, we're gonna use to exercise our shoulder. So, first, it's a flexion. It bends the shoulder. So, next is the extension. It straightens the shoulder. Next is the hyperextension. It is beyond the normal range of movement. And then adduction. It is away from the body. And then adduction. It is across the midline of the body. The circumduction. It is a sequential combination of flexion, adduction, extension, adduction, extension, adduction, and then flexion, and then adduction, extension, adduction, extension, abduction, and then flexion, abduction, extension, adduction. So now we're gonna do an external rotation. External rotation is a counterclockwise rotation. So Now we're gonna do an internal rotation, which is a clockwise rotation. So let's do it in both shoulders. So external rotation, counterclockwise, external. So now internal, external, external, internal. So now we're gonna do internal rotation. So internal rotation, it must be extension. It is at the level of the shoulder. So internal rotation, going forward, forward, internal rotation, and then we do the external rotation. It is backward. Now we're going to use the trunk. So flexion, extension, hyperextension. It is beyond the normal range of the movement. So flexion, flexion. It is I think 45 degrees. So next is the flexion, extension, hyperextension. So flexion, extension, hyperextension. Next is a lateral flexion. So like this, lateral, the trunk, and then we're going to do the rotation with the trunk rotation. Next is we're gonna use our elbow. So we're gonna do a flexion, it bends, extension, straightens, and then supination, the palm facing upwards. Pronation, it is facing downwards, the palm facing downwards, and then we also gonna do a rotation, hyperextension. So hyperextension is like that because it is beyond the normal range of movement. So again, flexion, the elbow, flexion, extension. This is a neutral. Then we do a supination, and then we do the pronation, and this is what we call the hyperextension. So in A, we do it again, flexion, extension, and then it is a hyperextension, flexion, extension, hyperextension. So we do it again. So flexion, extension, hyperextension, flexion, extension, hyperextension, flexion, extension, hyperextension. This is supination and this is pronation. Now we're gonna use our forearm in a pronation, supination, so that the position is in functional position. So this one, supination, pronation. So supination, pronation, supination, pronation, supination, pronation, supination, pronation, supination, supination, pronation, supination, pronation, pronation, pronation. So now we're gonna do a range of motion using my hips as a patient. So I will just going to expose the part that will do the exercise. So let's remove the sheet. So up to that. So in this part, or since I am the patient, I will still feel comfortable while doing the range of motion. So we're gonna do a range of motion in my hips as a patient. So we're in a neutral position, just straight. Then we're gonna do a flexion, and then a extension, and then hyperextension. It is beyond the normal range of movement. So in the Left side, we do the flexion, extension, and then hyperextension. Okay, we do it in the both hips. So, flexion, extension, then hyperextension. So now, in doing the range of motion exercise, we're gonna use our hand. So, we're gonna go, this is, since it is straight, it is what they call extension. So, let's form it like this, extension. So, we're going to do the abduction extension. So, it is spread, the fingers spread away from each other. So, adduction. And then, this is an adduction extension. So, abduction extension, and then adduction extension. Abduction extension, then adduction extension. Abduction extension, then abduction extension. So, now we're gonna do this as an opposition to little flexion of finger. So, when the tip of my finger bends and the thumb reaches it, it is the little finger, the index one, it flex. So the index finger do a flexion exercise. So, okay, this is an extension. So, opposition to little flexion finger. Since it is the index finger bends, it is flexion. And then when the thumb reaches the index finger, it is what they call opposition. So, let's do the opposition, and then opposition to little flexion finger. Okay, to extension. This is actually an adduction. So, adduction, opposition to little flexion finger, and then we do in a neutral position. So, when we do in a abduction position, we can also do it. Actually, it is abduction position. Then our index finger and the thumb reaches. So the index finger flexes to do a flexion. Then it is what they call opposition. Then now we do the extension flexion. So when we do it this way, it is an extension, and then we do a extension flexion. We flex the thumb, so it actually exercises the veins in my hand. It is just simple, but it do a lot actually, because the blood circulation in my hand circulates well. Now we're gonna use my knee to do the range of motion exercise. So this knee, we're gonna do a flexion, and the other one is in a extension mode. So this is flexion, and then this is extension. Flexion, flexion, then extension. It's like this. Flexion, this one is extension because it is straight. Then this knee bends, so this is what we call flexion, flexion, extension. So flexion, extension, flexion, extension. Flexion, extension. So, we're gonna do an abduction. So, abduction is away from the body. So, the knee away from the body. So, this is what we call the abduction. So, when we put the knee in the across the midline of the body, this is what we call adduction. So, abduction, adduction, abduction, adduction, abduction, adduction. Actually, when we do the abduction, we also do a flexion since we bend the knee. So, as I can see, this is the neutral or also extension, flexion, abduction, flexion, adduction. Now, we also assume that I'm still the patient and there is someone that will assist me in doing the range of motion because it is a passive range of motion. So we're gonna expose only the knee since the knee is the only part that going to do the range of motion. So let's expose the feet and to the knee. Okay. Only up to the knee to give the clients privacy. So the knee part. Let's cover the thigh. This is the knee, if you can see. Then we're gonna do a flexion. So the knee do the flexion and then extension. Flexion, extension, flexion, extension, flexion, extension, flexion, extension. So now we do the abduction, adduction, abduction, adduction, abduction, adduction, abduction, adduction, abduction, adduction, abduction, adduction. So we do it in a flexion position so that we can clearly see the process. So this is abduction, away from each other, then adduction to across the midline of the body. So abduction, adduction. Now we're gonna do a outward rotation using the knee. So outward rotation, outward rotation, outward rotation, outward rotation. So now inward rotation, inward, inward rotation, inward rotation, inward rotation, outward rotation, inward rotation, outward rotation, inward rotation. So, post-procedural steps after the range of motion exercise is to wash our hands and to make the patient comfortable by making the bed neat and clean. So, we're going to fix the sheet properly and we do the recording procedure. So now, after we do the range of motion exercise, we must document the procedure. So, let's record. And we also sign that the document that we record for accountability. And also, we must make a special considerations to move each joint through its full range of motion exercises 3 times and follow regular pattern of movements. We also need to put in a special consideration to provide a passive range of motion exercises 2 times a day for the development of the patient. We also need us to put support measures. It should be used to prevent muscle strain or injury during the range of motion exercises. So, a while ago, I also said that never do exercises beyond the capacity of the individual or the patient that will gonna do the range of motion exercise. And also, to prevent discomfort of the patient and the injury that was it.